Hi everyone, Nicola here. I just want to acknowledge that I'm on the traditional unceded territory of the Comox First Nation, just to begin my presentation. And today I want to um, go over Lush Valley, which I've worked for a year and a half, food security, food insecurity, the nurse's role, um, and what that all looks like for us. Um, so Lush Valley was founded in the year 2000, and the Lush Vision is a region where healthy local food is at the heart of community well-being. We work to support the Comox Valley community in gaining food system skill and knowledge to increase food security, self-sufficiency, and local food production across the region. This happens through a number of different programs, advocacy work, and partnerships with other organizations. So just to give a brief overview of our Lush programs, the Fruit Tree program is typically the most well-known. People register their fruit trees, volunteers then harvest the fruit trees when they're ripe, and the fruit's then shared a third each to the owner, the volunteers, and then out to the community. In 2020, 25,000 pounds of fruit and vegetables were harvested and redistributed. Farm gleaning, so that can look like picking up unsold produce from the farmer's market, as well as providing farm labor in exchange for unsellable produce. For instance, if there's a glut in the market, we might take that produce on from the farmers. The community gardens, so we have a few community gardens around town. The one that's specifically Lush Valleys is the Share the Harvest Garden on Harmston and 6th. Registered gardeners tend to their own plots, and we also hold workshops there. It's an accessible space, so we even have a couple wheelchair accessible plots there, which I think is really cool. The healthy food programs. So before the pandemic, we offered cooking classes, summer camps, and different workshops. And we also have the Healthy Student Meal Program. So that is making and delivering soup kits and snacks to 12 different schools on a weekly basis. And then the kids prepare those healthy meals for their classmates. Then we also have the hot meal program. So that started in April in response to the pandemic. 26,000 meals were delivered to folks through our partner organizations from April to December. And then finally, we have the Good Food Box program. So this in part was in response to the pandemic. And more than 11,000 boxes of fresh food, so fruit, vegetables, cheese, eggs, and bread, were delivered to households around the valley, again between April and December. In the peak of the growing season, all items were sourced locally in the valley, and people could apply for these boxes online or by the phone, and we deliver a box based on their family size to their household twice a month. So our goal at Lush is for all of our programs to be our goal is dignified accessibility, essentially. So we offer bursaries for all of our programs so that anyone can access them. So that's my plug on Lush. And then moving into food security, it's important in these discussions just to lay those definitions down so we know exactly what we're talking about, as definitions can vary across platforms. So the most well-used definition here is from the Food and Agriculture Organization, which is a branch of the UN, and they define food security when all people at all times have physical and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for an active and healthy life. So, just to have a deeper understanding of the definition, I came across the 5 A's, and that's kind of helped me build a better understanding of what food security looks like. So, considering the 5 A's, we have availability. Is there enough food? Accessibility. Can you get to the food and can you afford it? Adequacy. Are the food and its sources nutritious, safe to eat, and sustainable? Acceptability. Is the food and the system of delivery culturally acceptable and obtained in ways that don't compromise dignity, self respect, or human rights? Agency, also action. Are there policies and processes enabling achievement of food security? And if any of the previous elements aren't being met, what's being done to change that? So, looking into food insecurity is when any of the components I just mentioned are stressed or unmet. So, 1 in 8 Canadians experience food insecurity. And we're seeing that with the pandemic, that number is shifting to 1 in 7. Now, it's important to consider insecurity when discussing food security so we can identify the needs of people and work towards food security for all. So, I've added in Maslow's hierarchy of needs just to visualize the importance of food security. Food, water, shelter, and rest are foundations for a healthy human. Without these fundamental pieces in place, it's difficult to advance to thinking about safety, community, our future, or our potential. Food security is at the baseline of human need. Without it, we can't thrive, let alone survive. So, why does it occur? Well, for instance, we can see geography being an issue, um, like remote communities having limited access to food sources and environment as well. So, climate change can affect growing, and northern communities might have a more limited ability to grow food. But the biggest predictor of food insecurity is income, low income. Um, Whether that be through unemployment, which we're seeing a lot more with the pandemic, income inequality, other bills taking priority, and inadequate or precarious housing. Northern Health notes that food insecurity is an income based issue that requires income based solutions. So I just wanted to share a local perspective here. Andrea Capelli of the Coalition to End Homelessness and Marita Prado of Lush Valley recently wrote a report called Food Security, Poverty, Housing, and the Local Food System, Closing the Loop in the Comox Valley. And this report explores how the underlying root causes of food security are intertwined with issues of poverty, inadequate or precarious housing, and other barriers which block access to healthy and culturally appropriate food. So, if you're interested in learning more, that's a great local resource to read about food security. So, the impact we definitely see physical and mental health become compromised with food insecurity. Mental health issues can include chronic stress, anxiety, and depression. And compromised physical health. In a study by Community Food Centres Canada, 81% of food insecure folks that were surveyed stated that their physical health was compromised. There's a higher risk for chronic health issues like eczema, insomnia, headaches, digestive issues, asthma, and anemia. And we see this greatly affecting children as they develop. Um, and children comprise 30% of Comox Valley Food Bank users. The study also noted that people who are food insecure are 3 to 5 times more likely not to take medications as prescribed. So, food insecurity impacts people's eating behaviors, and coping strategies may be used to help deal with food insecurity. Some examples include purchasing low cost food, often of a lesser quality, modifying the quality and quantity of food, reducing caregivers' food portion to prioritize feeding children, and accessing formal and informal support. Formal being food banks, and informal being family or friends, for example. So I just wanted to share a couple quotes from Lush Valley customers. I'd like to say thank you to all of the people who contribute to this program. I haven't eaten this well in ages. I especially appreciate the fresh produce. I'm noticing a marked improvement in my health, both physical and mental. I deeply appreciate this food program. Being a diabetic is hard, and I'll surely welcome any veggies that I may receive. I think these quotes really show how fresh, nutritious food supports health and well-being. So, as always, we want to bring this back to the nurse's role and what we can do to help those who are food insecure. So, there's a lot of information for this slide. First off, we can screen clients for household food insecurity. So there's several screening tools that can help guide these assessments. There's the Poverty Intervention Tool, the Household Food Security Survey Model, and the CLEAR Toolkit. These are all easily accessible resources, just with a quick internet search. I also wanted to note 2 questions that you can keep in your tool belt for assessments. And they are, within the past 12 months, were you worried whether your food would run out before you got money to buy more? Was that often true, sometimes true, or never true for your household? Within the past 12 months, has the food you bought not lasted and you haven't had enough money to get more? Was that often true, sometimes true, or never true for your household? Next, we want to provide client-centered care. And a Northern Health resource that I'll share at the end of the presentation overviews what that looks like. So we want to acknowledge that provision of healthy food can be difficult, validate positive things the client is already doing, inquire about how much money is left for food after paying bills, encourage small, realistic diet changes with focus of adding on and not taking away. Want to consider barriers when referring clients to food programs. For example, stigma, transport, inappropriate food, and opening hours. And we also want to prevent the fear of stigma. So another option, we want to liaise with allied healthcare team members to best support our clients. So social work, for instance, can help navigate social benefit programs. Registered dietitians can provide nutrition assessment, counseling, and support. Aboriginal liaison workers can support Indigenous families. And mental health clinicians can screen, treat, and provide referrals. And then we also want to assist clients in accessing resources, whether that be financial, food, or social supports. One example is the A Hero Comox Valley Resource Guide, which again you can search online. It's an example that includes many different community resources. Some of the food access things that are listed include the food bank, Lush Valley, and the Sunshine Lunch Club. And finally, we want to advocate for improving food access. So this is probably a little hard for you to see, but we can advocate for guaranteed basic income, expanded social safety nets, affordable housing, more community gardens, utilizing food that would otherwise be thrown out, and implementing a food aggregation hub. Okay. So that's the end of my presentation. Thank you so much for listening. I've included my resources here, and for those who are interested in learning more, the BC Food Security Gateway offers a lot of great resources, and the Northern Health also has a great overview called Household Food Insecurity: Guidelines for Healthcare Professionals. Thanks.